Hi, I'm Minna,
And I'm Charlotte.
and we're going to be covering injury emergencies. There are three types of injury emergencies that we're going to be going over. There's broken bones and sprains, concussions, and internal bleeding.
So the first injury emergency we have is broken bones and sprains. So a broken bone and sprain is when a person's arm or leg looks deformed after a fall or accident. Some signs of broken bones and sprains are swelling, bruising, and pain when moving or bearing weight.
First, you're going to check the injury for any external wounds. Since there isn't any, you're now going to go ahead and place a towel or cloth over the injury. You then place your bag of ice over the injury for no more than 20 minutes. If you have any wounds, you're going to want to wrap them first. Take the person's injured limb and begin to wrap over the external wound. Make sure to check if the wrap is too tight by sliding 2 of your fingers into the bandage. If you can put 2 fingers into the bandage, the wrap is not too tight and is good to go. If the person experiences throbbing, raise the limb high in the air to alleviate the throbbing. Take the splint and make sure it is molded to the person's limb before using. Put the splint under the injury with the end just past the joint to keep it stabilized. Wrap a cloth to secure it into place. You can also use long, sturdy objects such as a ruler or cardboard if you do not have a splint.
Our next type of injury is a concussion. A concussion is a type of head injury in which a person's head or body is hit so hard that the brain inside of their skull moves. Some symptoms of concussion is feeling stunned or dazed, confusion, headache, nausea, or memory loss.
Concussions can sometimes happen out of nowhere. If you think a person might have a concussion, lie them down on the floor and have someone get an AED and first aid kit and call 911. To check for a concussion, take a pin light and shine it in one eye to make sure both eyes dilate together.
So the last injury we have is internal bleeding, and internal bleeding is bleeding that occurs inside the body. And you can get this from being injured in a car crash or having severe trauma to the abdomen or chest. So some of the signs and symptoms are coughing or vomiting up blood, bruising to the chest and abdomen, or nothing at all.
Internal bleeding can occur when a person hits their abdomen hard enough. Take the person and lie them down on the floor. Make sure to call 911 and get an AED just in case the person becomes unresponsive. To avoid shock, lay a blanket on the person to keep their temperature from fluctuating too much. Make sure the person does not eat or drink anything.
Thank you so much for watching.
Hopefully you know what to do in case of any of these injury emergencies, which included broken bones or sprains, concussions, and internal bleeding.
Thank you. Bye.
Thank you.